Fatal and non-fatal drug overdoses are on the rise in Fort St. John, and so far this year, more people have died from opioid drug use compared to last year.
In terms of what appeared to be accidental overdose deaths, we had one in 2015 in your community, and so far in 2016 there are 2 possible cases.
Dr. Fumerton says the local hospital and RCMP have seen an increase of drug overdose cases within the last few weeks and says it's a trend province-wide.
It's been an ongoing and concerning public health problem in the province, and certainly the North is no exception. We're seeing it here as well in many of our communities.
Northern Health says people are overdosing on various opioids, including Oxycontin and heroin, but fentanyl is among the dangerous substances of choice as well.
Things like fentanyl and fentanyl analogs are also opioids, but they're a lot stronger, and that's when people get into trouble when they are consuming what they think is one opioid, but it may be contaminated with others that are much stronger.
Fentanyl-related deaths are increasing annually in BC and within the northern region. Northern Health says a harm reduction approach to combat opioid overdoses is antidote naloxone, which could soon be available over the counter in BC.
In the event of an opioid overdose, it can restore breathing within 2 to 5 minutes. And can save lives and does save lives.
Besides being trained on how to use naloxone, Dr. Fumerton recommends users know what they're taking and to not consume it alone.
Don't mix different drugs, so don't mix opioids with benzos and other street drugs and alcohol. We also tell people that they shouldn't be using drugs alone.
The Fort St. John RCMP was unable to immediately comment on how many drug overdose cases they have encountered this year. For information on addiction services, visit our website at CJDC-TV.com. Kerrisa Wilson, CJDC-TV News, Fort St. John.